An upstate New York hospital in Lowville, New York, Lewis County General Hospital to be more specific, will be pausing on birth or delivering babies in 2 weeks starting around September the 27th, all over the COVID vaccine. I did not know you can pause on delivering babies. I thought they just came when they came, but things are really getting real. But by the way, welcome to my channel. This is Bruce the Boss Resurrected. And if you're not yet subscribed, please go ahead and smash on that subscribe button, like this video, comment on this video, and feel free to share this video if you like and agree with the content to help with the channel's growth. Now, back to the story. I don't think that there are many people who thought it would get this far. I'll be more than glad to share a link in the description bar below of the article in which I'm referring to. But it was just announced yesterday that this New York hospital, again, Lewis County General Hospital in Lowville, New York, which is in upstate New York, will be forced, no other decision but to pause on any, I guess, scheduled deliveries like cesareans and things of that nature all over the COVID vaccine mandates that have been forced. So I've done videos on this already on this new channel, talking about how the many on the left and in the political realm have been talking about this for months now, and they've been saying the quiet things out loud was that they were going to make life a living hell for those who were going to remain unvaccinated or not go with the program. Go ahead and check those videos out. And then I just recently, yesterday, did a video on my response to what I felt President Joe Biden did, which was pretty much declare a war on a good number of the American people, as well as on the 10th Amendment in terms of states' rights and their freedoms to act as they see fit within this experiment that is the United States. So go ahead and check that video out as well. But they basically, I think they were very much surprised with just how many people did not bend the knee. Yes, there was a crisis created that many governments around the world, shout out to Sweden for not falling into this trap, but practically every other country unfortunately did, and that they seized this opportunity to break the law and initiate policies that would further their agenda, particularly Agenda 2030, for anyone who is familiar with the World Economic Forum and their agenda that they set years ago. This was the chance for them to enact that. And I think they were surprised with how many people did not bend the knee and just bow to the rhetoric that was being pushed out there by mainstream media, yes, including Fox News. So despite that, many people still resisted it. I think they were so frustrated that even Mayor de Blasio used the term that, okay, we gave you the carrot on the stick, trying to lead you and tempt you to follow this course of path. Well, now we're taking away the carrot and only giving the stick. I think they really, really got agitated that more and more people did not bend the knee. I think a lot of decisions that were made to see who would submit. And again, whatever your decision is should be respected. Whatever your decision throughout this process should be respected, just so long as you also respect others. I believe they are trying to divide the people up. If it wasn't based upon ethnicity, skin color, religion, and then, yes, politics, now they're trying to start up a war between the vaccinated and unvaccinated. And we cannot do that, because the only way we can get through this is together, regardless of what your decision and personal decision was. And I would always say consult with your medical doctor to decide what's best for you based on your specific medical condition and or your risks, which are unique to you. And we should respect that. And regardless of whether or not, if you were at risk or not, and you still chose to get it or not, again, showing support and solidarity. Now, back to the story at hand, more specifically, as it relates to what's happening in New York. So more specifically, prior to what President Biden just announced, as you know, a lot of states and or cities were enacting their own policies, as well as many private organization businesses. And more specifically, disgraced former Governor Andrew Cuomo, back on August the 23rd, prior to his final resignation, did initiate a state executive order mandating healthcare workers to, at the very least, get one dose of the vaccine no later than September the 27th, 2021. And so at this particular hospital, they just announced over either Friday and or on Saturday that over 30 of their staff have already put in resignations over this, 7 of which worked in the maternity ward, and they still have another 7 maternity ward employees who have not made a decision one way or another. In fact, over 165 healthcare workers at this hospital, this very same hospital in Lowville, New York, has Lewis County General Hospital in Lowville, New York, 165 staff members at this one hospital. That's approximately 27%. Have not yet made a decision as to whether or not they're going to take the vaccination. That should say a lot about the vaccine as it pertains to and add to the nuances of the debate and the discussion. Because here you have healthcare workers, trained medical professionals, even if it's a lot of nurses, more so nurses than those with PhDs. These are still individuals who have spent countless number of hours and several years of intense medical training, study, and practice. And they're in the field that has already mandated them to take a plethora of different vaccinations in order to work at the hospital. So they're not anti-vax. There's this myth that those who are, whether they be hesitant and or just against this particular vaccine, there's this myth that, oh, they're anti-vaxxers or anti-science. No, a lot of individuals who don't want to get this vaccine right now are not anti-vaxxers. For instance, myself, I definitely plan on getting the shingles vaccine when I hit my 50s in like another 17 years or so. All right, I definitely plan on getting that. I mean, that's been around for decades. But this should say something when you have, again, if you're not aware of what it takes to even be a nurse, you really should look into the hours and hours and hours and years of additional study. It's not just you go through this 4-year program in college. Nursing schools require a lot of years for you to complete their program, several hours of actual study, practicing, and or residencies. So these are individuals who are very well educated in these matters and what's going on, how the body works, the anatomy, and vaccinations. And they've taken several for their job already. Why are they hesitant about this one? There's a lot of nuance to the conversation. For instance, for one, a lot of people will just ignorantly say, well, it's been FDA approved, not knowing what the normal process for FDA approval really is, which is something that takes years. In fact, even for the Pfizer vaccine that was just recently FDA approved, because they thought that would be what will get many people over the hump, they haven't even started many of the required and scheduled clinical trials that are set for 2023. They haven't even started those clinical trials yet because they're well over a year out. So this is we have a Pfizer vaccine that didn't even go through the required normal process, despite the fact that there are other forms of treatment, not cures, but other treatments out there that you can consult with your doctor to get through COVID successfully, much like Joe Rogan. All right. And yet they rushed this. Why? But it was, in fact, rushed. It didn't go through the normal process. So there are legitimate questions and or concerns. We can, yes, submit that for the overwhelming majority of people who get the any of the vaccines, whether it's Moderna, Pfizer, AstraZeneca, Johnson & Johnson, that the overwhelming majority of people, it is safe for them. There are no repercussions or adverse conditions, while still acknowledging the fact that there are a segment of individuals who have had adverse reactions to it, whether it be anaphylactic shock, a high number of youths having accelerated cardiac rhythms and their heart rates, to some degree is dangerous. A lot of young individuals also from the AstraZeneca getting blood clots. So we can acknowledge, and there have been thousands of reported deaths after it, but it's such a small number. But we can be honest and say, for the majority of individuals in the short run, that it is safe. There are really not many negative side effects or risks, at least not that we know of. But one thing we can also speak to is that there are also a lot of unknowns because this vaccine is barely 10 months, 11 months old. Yeah, no, not even 10 months old. So we don't even know what the long-term repercussions are of this. It's a complete unknown. We don't know how this affects fertility, for instance, and or babies being born from mothers who have been vaccinated, who've had their DNA altered. We don't know. We can't say that it does affect it, but we don't know because, again, in large part, this vaccine has not been made available to the overwhelming majority of the population. Actually, it hasn't even been made at all for what would be a complete duration from beginning to end of a birth, because contrary to popular mythos, the average pregnancy is not 9 months. It's actually a normal pregnancy should go 10 months. And even then, we still have not had the vaccine available to the general public for 9 months. Even then, on the low end of the spectrum, the vaccine did come out around January, but it was only made available to the frontline staff and frontline workers, and then being rolled out to those most vulnerable, i.e. the elderly, before not until sometime February, March, they started rolling it out to even more and more individuals within the public. I don't think it was until April when it became more massively available to almost all adult, American adults. So we don't know what the repercussions are from the conception to birth and then thereafter yet. So there are a lot of unknowns to this vaccine that a lot of people aren't acknowledging. So, it was rushed, but it passed FDA approval. Okay, but there are a lot of unknowns and not everyone is at the same risk. So I think that this definitely adds a lot of nuance to it. The fact that so many medical professionals who have already been willing to inject themselves with numerous vaccines for the sake of their job are pausing on this one. And I don't think that the powers that be really expected that this would probably be the line in the sand for so many Americans, because they figured, let's do as big of a switch as we can. We'll limit their freedoms and what they can do, making them second-class citizens. Oh, you can't go to this restaurant. You can't go to this gym. You can't go to this bar. You can't have this wedding. You can't do X, Y, and Z until you get the jab. Still, more people said, screw that. So now they're threatening people's livelihoods and jobs. And I don't think they realize what a furnace they lit under a number of people who are willing to, quote unquote, die on this hill, and how serious this is. Because again, you have this many people already willing to lose their jobs in this healthcare profession because they're saying, I will not take this. Again, we have 30 resignations from this Lowville hospital in New York. 30 confirmed, with another 165 people who, despite only have 2 weeks left to make a final decision as to whether or not they get the first dose or not, 165 people have still sat on the fence and said, all right, I don't know. So if all of the remaining 165 decide, I'm out, that's over 200 people in 1 month. You cannot replace that. And I do think that they're going to need to start rethinking their policies and or strategies as it pertains to these mandates, especially, is it really necessary? Can you stop this with the vaccine, especially in light with what's going on in Israel, the most vaccinated country in all of the world? Over 81% of their population has been vaccinated, and the lie that people are trying to perpetrate that this is a pandemic now of the unvaccinated, that's a very ignorant statement to make in light of what we're seeing in Israel and the fact that we're seeing nothing but practically a majority of breakthrough cases, as they call them, happening out there. And their numbers are now higher than they ever have been at any point in time. So it's proof that this vaccine does not stop you from getting the virus. It does not stop you from spreading the virus at all. It may add an extra layer of protection, but then at the same time, I like to compare it to, for certain individuals and their demographics, it's like putting an extra layer in front of the bumper of a Hummer. Does a Hummer need that extra bumper in front of the current bumper that's in there? Do you really need that extra layer of protection for most individuals, for most demographics? And the answer is no. This virus does not affect every demographic the same. It's not the same negative prognosis for all individuals. For the overwhelming majority of young people in their 30s and 20s, and yes, teens, who are healthy, in shape, no other pre-existing conditions like asthma, type 2 diabetes, they're not obese. For the majority of young people in their 20s, 30s, and teens, this would barely be a cold, mild allergy-like symptoms. If that, a large majority are also asymptomatic. This has not hit the younger individuals as hard as it's hit people in their late 40s, throughout their 50s and 60s. That's just a documented fact, unless if they, again, have one of those conditions. You're always going to have anomalies, but if we're going to start talking about those anomalies, we'll talk about the adverse reactions to the vaccine then, which are also anomalies based upon the numbers, despite the fact that OSHA is now incentivizing individuals and their providers to not report adverse reactions. So we know what that's about. So I just find that very interesting. A latest development. We'll see how more shoes fall with this, especially with Biden's new mandate and how this will affect many people. Although shout out to all of the governors, mine included, Governor Greg Abbott of the great country of Texas, who are pushing and fighting back against this federal mandate on workers' rights. So we'll see how this goes. Will this further tank the economy as well? An economy that was already in shambles thanks to certain various policies. We'll see. So that's my video today. Thank you for watching. Again, don't forget to subscribe to my channel, like this video, comment on this video, and feel free to share this video. This is Bruce the Boss, and I'm out. Peace.